Hello and welcome to any journalists who are on the line. And Laura Mae, please go ahead.
Thank you so much, and thank you to everybody for coming together today. Today we are all here to call on Doug Ford to implement paid sick days for all Ontarians. My name is Laura Mae Lindo. I'm the MPP for Kitchener Centre and the official opposition critic for colleges and universities, as well as for anti-racism initiatives in the province. And this morning, I'm joined with my colleague, Chris Glover, MPP for Spadina Fort York, which is one of Toronto's hotspots, as well as with Dr. Gabrice Stephen, an emergency physician at Credit Valley Hospital in Mississauga. And we are also joined by two Ontario medical students and members of the Ontario Medical Students Association, Gurinder Sandhu and Sinthu Senthilmohan. For months, health experts and scientists across Ontario have stressed the importance of paid sick days for all Ontarians. And for months, the Ontario NDP, Ontario's official opposition, have echoed this call, using every tool available to us to push Doug Ford government to legislate paid sick days for Ontarians. We have used debates, legislation, member statements, and calls for unanimous consent motions to move discussions by this government away from partisan politics and towards the science. Ensuring that everyone in Ontario has access to paid sick days is a critical step in our fight to flatten the curve during what has already proven to be the most horrific third wave of the COVID-19 pandemic. And yet, on Friday, April 16th, rather than listening to frontline healthcare experts, which includes frontline healthcare workers, scientists, epidemiologists, and the rising cries from everyday Ontarians, Doug Ford chose to fight a global pandemic by moving Ontario into a police state. We cannot police our way out of this pandemic, and empowering the police will not flatten the curve, but real investments in our healthcare system and protecting essential workers will. This includes ensuring that every Ontarian has access to paid sick days so that they do not have to choose between going to work sick or missing a paycheck. Today, we are joined by a number of people who are also joining the chorus of Ontario residents that are demanding that the government invest in our healthcare system. They are demanding that their elected representatives take the science seriously. They are demanding that the Ontario government do better and ensure that everyone in this province has access to paid sick days. So now I would like to turn it over to my colleague, Chris Glover.
Okay. Thank you so much, Laura Mae. So I'm Chris Glover. I'm the MPP for Spadina Fort York. And I want to start off by saying that everyone in Ontario owes a debt of gratitude to medical students. They are frontline workers who are putting their lives on the line, and we need to listen to them. Today, they are saying we need paid sick days to help us get through this pandemic. And the government keeps talking about the Canada Recovery Sickness Benefit, but those are not paid sick days. Even the federal government says those are not paid sick days. It's a maximum of $450 a week after taxes. You have to be away for at least half a week minimum, and it can take 4 weeks to collect. And there are many precarious workers who cannot pay their rent or feed their families if they rely on that federal benefit. So they need the paid sick days so that they can stay home when they're sick and so that we can get through this pandemic quicker. The government's actions have walked us right into this third wave. We had a record number of residents in hospitals over the weekend, and the government says they're listening to medical experts, but the medical experts are right here on this call today. The medical students of Ontario are here, and they're saying we need paid sick days because that is one of the measures that will help us get through this pandemic quicker. The NDP has already put forward 2 bills on paid sick days. Today, we'll be introducing a unanimous consent motion asking the government for paid sick days. And we're putting out more and more formal calls each week about this to get the government to finally listen and take actions, because the sooner that Doug Ford starts listening to the medical experts, the sooner we can get through this pandemic, out of lockdown, the more lives that will be saved, and the sooner we can get on with our own lives. So I want to thank the Ontario medical students for being here. I want to thank my colleague, Laura Mae Lindo. Over to you.
Thank you so much, Chris. And I'd like to hand it over to Dr. Stephen.
Thank you, Laura. Paid sick days is something that impacts patients in Ontario all the time. It has been a lack of paid sick leave has been a problem even prior to the pandemic, and the pandemic has made it just that much worse. I work in a community that has been one of the hardest hit communities by COVID-19. I take care of COVID-19 patients nearly every shift, and I have been doing this for the last year as an emergency physician. In the community where I practice emergency medicine, 66% of people got COVID-19 from a workplace. 1 in 4 people went to work with symptoms. And this is reflected in what I do in my day-to-day practice. When I talk to my patients, they tell me, "Doc, I can't afford to stay home." If you think about it, it makes sense. COVID-19 early can be fairly asymptomatic for most people. While many of us have the luxury of waking up in the morning, and if we have a small scratch in our throat, we could choose to stay home, this is not a luxury for so many Ontarians that are living paycheck to paycheck. A lack of paid sick leave means that my patients who have already been living on $24,000 a year, working 40 hours a week, who are just keeping their head above water each and every week, would completely drown. The reality is, paid sick leave makes sense. Paid sick leave is based in evidence. We have evidence. In 2009, we have evidence from H1N1. A US survey showed that a lack of paid sick leave led to upwards of 7 million additional cases of H1N1. We know that paid sick leave curbs pandemics. Here's the thing. I'm an emergency physician. My job is to identify medical emergencies. I treat patients that I've identified with a medical emergency, and they'll tell me, "Doc, I can't stay for treatment. I got to go to work." And so it makes me wonder, if I've identified a medical emergency, and that's what I'm trained to do, and when patients sign out of the emergency department in order to go to work, it makes me really question whether or not our system is built in a way where workers can thrive, or is our system built in a way where workers are just barely surviving each and every day? And that's why within this pandemic and beyond this pandemic, we must legislate permanent employer-provided sick leave. And I am so honored to be here alongside our medical student colleagues in order to put this forward to our leaders. Please, for my patients, for the patients here in Ontario, meet the moment. Legislate paid sick leave.
Thank you so much, Dr. Stephen. I'm now going to hand it over to Gurinder.
Thank you very much, Laura. While the rest of the province is able to work from home and remain protected, over 2 million essential workers from across the GTA and countless others from across the province do not have that luxury. A stay-at-home order that doesn't address the risk of COVID spread in the workplace is destined to fail. Many of the essential workers are forced to work in close quarters where social distancing is not possible. The term essential worker has been thrown around a lot in discussion since the lockdowns began, but I'm concerned now that the humanity behind this term is being forgotten. Who are these people that we call essential, and what can we do to support them, just like they support us by showing up to work every single day? For me, essential workers are my friends, my family, and my neighbors. I grew up in Scarborough, a current hotspot for COVID-19. Hotspots are not the result of poor personal decisions. Hotspots are the result of public policy that doesn't protect the people that are keeping Ontario moving. They work in transit, distribution, factories, food manufacturing, retail, and caregiving. They're the ones that make sure Ontarians have everything they need to stay at home safe and healthy. Every single day across the province, there are people like my friends and family that have to go to work sick because they cannot afford to skip pay. No one should have to choose between being able to pay their bills or following public health orders and self-isolating when symptomatic. Our provincial leaders have the power to change this by legislating for mandatory paid sick leave that is accessible and universal, no questions asked. The experts have been clear about this. Mandatory and accessible paid sick leave is an essential step in slowing and stopping an unmitigated disaster. We can't afford to wait any longer. That's why I'm urging the provincial leadership today to take the necessary steps now. Instead of focusing their efforts on measures that are not supported by evidence, we should be deferring to the experts. This policy would be directly responsible for saving countless lives. Essential workers are not some faceless group. They're my friends and my family. They want to work and help Ontarians, but without the necessary interventions from the province, we're asking them to put their health at stake unnecessarily every time they clock in. Accessible and mandatory paid sick leave can and must be legislated at a provincial level. Thank you.
Thank you, Gurinder, for those powerful words, and I am sending it over to Cynthia.
Thank you, Laura. So I sit as a council member on the Ontario Medical Students Association, an organization that represents the views and concerns of over 3,000 medical students across the province. Throughout this pandemic, I've witnessed firsthand how medical students have stepped up to the plate and helped those on the front lines wherever they can. Whether it's dropping off groceries and babysitting or contact tracing, vaccinating, treating patients, medical students have done everything in their capacity to bring an end to this pandemic. In the same way, we're now asking the provincial government to do all that they can to end the pandemic by first legislating universal, accessible, and permanent paid sick leave. Just last week, our provincial association put out a statement in support of paid sick leave. Our colleagues at McMaster led a petition that got over 600 signatures in support of paid sick leave. And med students came out in droves to call and email their MPPs about legislating paid sick leave. I think it's unsurprising that so many of us are in support of this issue. My classmates come from diverse backgrounds, ranging from epidemiology to economics. But what we all have in common is that the exposure to how gaps in public health policy hurt the most marginalized in our communities. It's no coincidence that COVID-19 has disproportionately impacted folks that are women, racialized, disabled, low income. And unsurprisingly, these workers are also the most likely to not have paid sick leave. We see every day how badly this pandemic hurts essential workers without protections. Even workers on our healthcare teams, nurse practitioners, radiation technologists, hospitality, personal support workers, sometimes don't have adequate paid sick leave. Now add in the 70% of low-wage essential workers without paid sick leave, and you have a healthcare system overwhelmed by preventable COVID cases, both in its patients and in its workers. As med students, it's been incredibly difficult witnessing the toll that this pandemic has had on our peers, colleagues, teachers, communities, especially given that so much of it is preventable. We need public health measures that are shaped by the science, and the science says that we need paid sick days and we need them now. Thank you.
Thank you so much. And thank you to everybody again for joining us. I just want to reiterate that these calls have been ongoing. For months, we've been calling for paid sick days. And for months, the science table has told us that that is what we need to keep people safe. For months, we've had people on the front lines use every tool available to them to try and get this government to listen and make this mandatory so that we can protect the people that are in hotspots and those that are literally being told that they must go to work in the midst of this pandemic. And now we've got students adding their voices as well to this call. I am hoping and staying optimistic that the government will finally listen as the calls get louder and louder and louder. And now I would love to open it up to any journalists that are on the line for any questions they may have.
And a reminder to journalists to please use the raise hand function if you'd like to ask a question. Okay, there are no questions on the line at this time. Laura Mae.
Thank you. Thank you again for joining us. Thank you again for adding your voices to these calls for paid sick days. Please know that your official opposition will not stop fighting. And thank you again for coming out this morning. Please stay safe and thank you for all that you do for us.